We know what you're thinking. What is hemophilia? Well, here's a quick overview of the ins and outs of hemophilia. Hemophilia is a hereditary blood clotting disorder caused by abnormal blood clotting proteins. In most cases, people with hemophilia have normal amounts of the deficient protein circulating but is in a functionally inadequate state. People with hemophilia bleed longer, but the bleeding is not any faster than a normal person. Certain genes on the X chromosome determine how the body makes blood clotting factors. Any defect in these genes can cause hemophilia. People with hemophilia typically have lower levels of either blood clotting factor 8 or factor 9. There are many different types of hemophilia. Hemophilia A, aka classic hemophilia, is caused by a decrease of clotting factor 8. Hemophilia B, aka Christmas disease, is caused by a decrease of clotting factor 9. Most types of hemophilia are inherited. However, about 30% of people with hemophilia have no family history of the disorder. In these people, an unexpected change occurs in one of the genes associated with hemophilia. Acquired hemophilia is a rare condition that occurs when a person's immune system attacks clotting factors in the blood. Risk factors include pregnancy, cancer, multiple sclerosis, and autoimmune conditions. Did you know that the diagnosis of hemophilia A is 4 times more likely and it affects 1 in every 5,000 male births? Also, 400,000 individuals in the world are currently affected. Bleeding into the joint space, also known as hemarthrosis, is one of the most common manifestations of hemophilia. It affects the knee, elbow, ankle, hip, and shoulder. Recurrent hemarthrosis can result in joint disease, which causes signs and symptoms such as tingling sensation, tenderness, loss of motion, muscle atrophy, and flexion contractures. Depending on the degree of injury, the severity may vary from mild pain and swelling, which resolves without treatment within 1 to 3 days, to severe pain with very swollen joints that last for several weeks and resolve slowly with treatment. The second most common manifestation is bleeding in the muscles. Bleeding may occur anywhere in the body, but are most common in flexor muscle groups. Bleeding in the muscles results in signs and symptoms such as club foot, intensifying pain, spasm of the muscle, and loss of sensation. Other signs and symptoms of the central nervous system include seizure, hemorrhage, lethargy, and apnea. Signs and symptoms of the GI tract include abdominal pain, fever, vomiting blood, and blood in the stool.
Males will inherit hemophilia if their one X chromosome has a mutation. Hemophilia is rare in women because both X chromosomes must be affected. Most people are diagnosed at a very young age. Based on CDC data, the median age at diagnosis is 36 months for people with mild hemophilia, 8 months for moderate, and 1 month for severe. In rare cases, a person can develop hemophilia later in life. These involve middle-aged, elderly, or young women who have recently given birth or are in the later stages of pregnancy. So how do you diagnose hemophilia? It's done through coagulation screening, clotting factor tests, and genetic testing. Coagulation screening test looks at the time it takes for the blood to clot. Clotting factor tests help diagnose the type of hemophilia that may be present as well as severity, and genetic testing can find DNA mutations that may be present. With the use of clotting factor tests, both types of hemophilia are classified as mild, moderate, or severe. Currently, there is no cure for hemophilia, but there are ways to treat it. The most common way is called factor replacement therapy. For hemophilia A, factor 8 is replaced. For hemophilia B, factor 9 is replaced. These clotting factors are given on demand at the time of injury. For more severe forms of hemophilia, the replacement of factors are given on a schedule, usually 2 to 3 times a week, but the dosage must be monitored closely, so it's important to consult your doctor to get the correct dosage. What role do physical therapists play? PTs can help reduce bleeding episodes by strengthening the muscles, gait training, education, controlling pain, preventing further injury, and giving emotional support. Patient-client education is extremely important. Many people with hemophilia don't exercise because they fear it could cause bleeding, pain, and injury, but PTs are here to tell patients that exercise has many great benefits. The National Hemophilia Foundation has categories of activities that are safe to do as well as those that are dangerous. Category 1 are the safest activities, Category 2 are moderately safe, and Category 3 are potentially dangerous. A systematic review found that participation in physical activity, exercise, and sports has many physical benefits as well as gives support to the emotional and social well-being of patients.
New research shows that a new drug called Hemophilia has been shown to reduce bleeds. It demonstrates an 87% reduction in treated bleeds, an 80% reduction in all bleeds, and a 95% reduction in treated target joint bleeds. Hemophilia is an antibody that joins factors 9 and 10 to do the job of factor 8. The internet contains a variety of resources for patients with hemophilia, such as the World Federation of Hemophilia, the National Hemophilia Foundation, and hemophilia treatment centers. As always, patients should contact their physician with additional questions or concerns regarding their treatment. Thank you.